I have lower back pain.
Constant pain.
Numbness in my hands.
Spine tumor.
Brain tumor.
Here in Wyoming, we frequently see a lot of spinal conditions because of our hardworking citizens. So we tend to see a lot of cervical and lumbar spine conditions that result in painful backs, sciatica, arm pain, numbness, and tingling. And so we do a variety of techniques, both surgical and non-surgical, to treat those.
Patients are often sent to us with suspected spinal disorders. Part of our training and thorough approach allows us to sometimes determine that the pain is coming from other parts, such as hips or knees or other arthritic conditions not related to the spine.
Here at Wyoming Medical Center, we see a variety of both brain and spine tumors. We see malignant brain tumors, benign tumors of the lining of the brain.
Anything from trauma to spinal surgeries to brain tumors to aneurysms. An aneurysm is a condition in which a patient has a weakening of a blood vessel in the brain. Aneurysms can also occur in other parts of the body. There are several ways an aneurysm can be treated. The traditional treatment of an aneurysm was a surgical approach where we would have to enter through the skull into the brain, find the weak portion of the aneurysm, and place a small clip across it. Today we have other strategies that can be performed by an interventional radiologist. These strategies can be performed by going through the blood vessel in the groin up into the blood vessels of the neck, and oftentimes a small stent or coil can be deployed to obliterate the aneurysm and eliminate the risk of it bleeding.
By virtue of working at Wyoming Medical Center and having access to so many different specialties, including orthopedics, pain management, injection therapy with radiology, we work with our radiology colleagues quite closely because a variety of their tools and techniques are helpful to us. This would include, of course, the use of CAT scan or CAT scan perfusion studies, MRI perfusion, spectroscopy, as well as injection therapy, including injections for painful conditions such as sciatica, or angiography to diagnose conditions such as brain aneurysms.
Parkinson's disease is a loss of dopamine-producing nerve cells within the brain. Oftentimes this can be treated with medication. However, sometimes patients become resistant to the medication. There are surgical treatments that can help manage the symptoms of Parkinson's disease. One of these includes deep brain stimulation, which is a procedure that we perform at Wyoming Medical Center.
Because of Wyoming's large geographic area, it allows Wyoming Medical Center to serve as a regional hub.
Wyoming has one of the lowest populations in the United States. However, this population is quite spread out. We oftentimes will do clinics up to 2 to 3 hours away in towns as small as 5,000 to 10,000 people just to provide these critical services to their communities. Statistically, 80 to 90% of patients with back pain can get better with non-operative treatment. At Wyoming Brain and Spine Associates, we try to maximize these non-operative treatments before considering surgical treatment. While surgery is oftentimes safe and effective, risks and complications can occur. This is one of the reasons why we try to treat a patient in a non-surgical fashion if this is a possible solution for their pain. Conservative treatment options may include things such as physical therapy, anti-inflammatories, and possibly sometimes even targeted injection therapy.
I need surgery.
I need therapy.
I need to feel better.
Wyoming Brain and Spine Associates. Surgery when you need it, appropriate treatment when you don't.